Hi, I'm Steve Garber. I'm an obstetric anesthesiologist from Laguna Hills, California, and I practice at Saddleback Hospital. I've been in practice about 35 years there. We are a center of excellence for obstetric anesthesia. We have high-risk obstetric anesthesia population. I find it helpful in a lot of different patients. One is everyone knows the BMIs are going up, so sometimes it's very difficult to palpate. If you just start with the midline, okay, the midline is so important in identifying and putting in an epidural safely and quickly. So it immediately identifies the midline, which I find so useful, and then going from there and targeting exactly where you have to go. The AI that's incorporated with the device is fantastic, and it really is X marks the spot for me. It's helped me in several different patients. One is that if it is going to be a difficult patient, and let's say they're going very quickly, and they're going to be at 8 or 9 centimeters and they need an epidural and they want to have some pain relief, or maybe they're thinking of doing a vacuum or there's some other procedure in it where they need pain relief. So the Accuro is going to help me identify the midline, identify the space, get the epidural in quicker, and in addition, for doing spinals as well. If you're doing a C-section and you're doing a spinal and you have a difficult patient, there's a big push now to try not to do, and this isn't new really, but with these larger BMI patients, not to do general anesthetics. And sometimes if you have an urgent patient, you can get a spinal in quickly and avoid a general anesthetic. You're going to avoid all the complications with general anesthesia. And if you can quickly get a spinal in and the Accuro can help you, that's going to be safer for the patient and the baby. So I had a patient, Zoe was her first name, and she had a lot of instrumentation in her back from a previous auto accident, because she had instrumentation from the thoracic to the middle lumbar area. And I actually was able to scan her in her doctor's office prior to her being in labor, which was really helpful. And I was able to scan and I saw a space. She came into labor and I was able to use the Accuro and find the space, and she had a safe and nice laboring experience because I was able to use the Accuro to get the epidural in place. Oh, I absolutely would recommend Accuro to my peers, and here's why. We have a toolbox of stuff, and if you have something that is going to potentially help you get an epidural in quicker, safer, then why wouldn't you have and use it? And here's what I tell people. I mean, I hear OB anesthesiologists say, oh, I never have a problem with an epidural. And we all know that's not true. Everyone has a problem once in a while. And if you have a tool that you can reach for that's going to help you, then why not have it and at least have it available?